Hi, I'm Charlene Day. I'm an Associate Professor of Medicine in the Center for Inherited Cardiovascular Disease at the University of Pennsylvania. And today I'm going to talk to you about important questions to ask your patients about their symptoms and their family history. So first, I always ask about the nature of their symptoms and their consistency. So for example, what brings them on? Do they occur reproducibly with the same level of exertion? So this is particularly important for shortness of breath or for chest discomfort. And then the second component is duration and chronicity. How long have they been occurring? Are they progressive over the period of time that they first noticed them? And importantly, are they able to keep up with their peers, their family, or their friends? And this last question is particularly important for pediatric patients or young adults who have lived with this condition most of their lives, because they may not have a metric to compare to in terms of what is supposed to be normal. How are they supposed to feel? Because they've always felt this way, so they always just assume that was normal. So it's really important to ask them in comparison to other people their age, how well do they keep up physically? And then the third component is physical activity adaptations that they may have made. So I asked them in detail about what exercise or regular activity they do that's part of their daily life or routine. And then I ask how this compares to what they used to do 1 year ago, 5 years ago, or even 10 years ago. And I think this can be really telling because the chronicity of symptoms can be quite long, and the progression happens over a long period of time. So really think about the importance of the chronicity when you're asking these questions. So the symptom onset for patients with HCM tends to be very gradual and often unrecognized or misattributed by the patient or their providers to other diagnoses, such as asthma or being out of shape or getting older. So let's move on to important questions to ask about family history. So first, we always construct a 3-generation pedigree, ideally with the assistance of a genetic counselor. Second, we ask about anyone in the family who has had a cardiomyopathy or enlarged heart or heart failure, or even atrial fibrillation, because oftentimes family members may carry a diagnosis of atrial fibrillation, but their HCM may have gone undiagnosed. And in individuals who have developed these conditions at young ages, that's particularly suspicious for hypertrophic cardiomyopathy. Then we ask if anyone's had a sudden unexplained death or a sudden heart attack, and at what ages these may have occurred. And if they had a heart attack, were they known to have prior blockages in their coronary arteries? Did they have prior hospitalization, stents, or bypass surgery? In other words, was there a previous coronary history, or did this event occur suddenly with no prior history whatsoever? And importantly, was there an autopsy? And if so, we try very hard to get the report and to find out if a blood sample has been saved that we could use for postmortem genetic testing. And then a couple of additions. This comes up periodically, drownings. So somebody died, drowning, swimming in a pool or the ocean or a lake. Were they a good swimmer? And was there current or other factors about the water conditions that may have led to their drowning? If they were someone who was a high school swimmer and they died swimming in a pool in their backyard, that's pretty suspicious for a sudden cardiac arrest. And then motor vehicle accidents, sort of the same idea. If they were the driver and there were no passengers in the car, it was a single vehicle accident, and there was no alcohol or drugs involved, that would also be suspicious for a cardiac event. Thank you so much for your attention as we discussed important questions to ask patients with HCM about their symptoms and their family history.